All right, everybody. So we're going to review some of the key concepts from our week 3 case study and Career Connect assignments. So we're going to look at the case study first. One of the important things that I like to remind everyone with these case studies is to utilize the information provided, right? So in this case, I often see errors as we provide a specific examination and items not included in that examination are discussed. All right, so it's important that, again, you're using the information that we provide in order to answer the questions correctly. So the first thing that I really want to bring up is what part of the nervous system results in paresthesia. So this question, paresthesia is it's a sensory symptom, right? Paresthesia is kind of the tingling type sensation when something happens, like a nerve gets compressed. So we see this very commonly in stuff like carpal tunnel syndrome or like a spinal radiculopathy type syndrome. Paresthesia is purely sensory. There's no motor aspect to it. So when we're looking again at motor versus sensory in the spine, we utilize two different terms. You have efferent neurons and afferent neurons. It can be tough to keep those ideas combined, but I like to use the acronym SAME. So you have sensory is afferent, so SA. Motor is efferent. Okay, that's a quick, easy way to keep those in mind because the study of the nervous system it realistically does get a little bit more complex than just the idea of sensory and motor. And that's why afferent versus efferent is important, because really what we're looking at is whether the neuron causes an action or it receives an action. Okay, and in certain contexts, like in the brain and certain areas of the central nervous system, there are neurons that do both, right? So and typically, we might group those guys together and call them interneurons. They can do both, right? So it does get a little bit more complex than what we're just there. So our next question: what following results can come from our nervous system exam only? Remember, the central nervous system's function is primarily integration of senses, processing of those senses into useful information, and then higher executive action, which includes things like motor planning, memory, emotion. So, with the idea in mind that a motor action can be created in the periphery, sensory actions exist in the periphery, and things like balance and coordination happen in both have both a sensory and a motor component to them, meaning it happens realistically in both peripheral and central. That really only leaves us our options related to higher order functions. So our thoughts, our thinking, right? Emotion, memory. Those key things are controlled only by the central nervous system. Okay, so that's kind of where we want to go with that question. Then next, last question to cover for the case study. Based strictly off the findings in the neurological exam, meaning the exam provided, what type of test is most likely performed by the neurologist? So again, you look back at the what's tested in the examination. And then what we'll do is we will look at our options. So the first thing, there's two things we can quickly rule out. listening to the patient's heart. Now, there's nothing about a cardiovascular examination, right? So that is not true. That did not happen. Another option is percussing the patient's lungs. Again, no lung exam, nothing about respiratory symptoms, so we could quickly rule that one out. Now there's two options left: testing reflexes or having the patient lift their arm against resistance. So lifting your arm against resistance is a very easy way to examine for weakness. And the other option is testing for reflexes. Again, reflexes is a examination, especially your reflexes in this context, is an examination of spinal reflexes. So you would test a reflex, everyone thinks the patellar reflex. You have a quick tap to the patellar tendon, you get a little bit of a knee jerk. There's a sensory component by tapping the tendon, and then a interneuron connection within the spinal cord that then causes a motor action via a motor nerve. So that was not tested at all in this examination because there was nothing mentioned about reflexes ultimately, right? All right. So now I'm going to open up the Career Connect. All right, so first thing with the Career Connect to talk about is our question asking about the prednisone that the patient is given. So remember, prednisone is a medication that is a corticosteroid, and it is used for all the things that corticosteroids are used for. So we could see it used for chronic inflammation. It could be used in conditions like Addison's disease, but really we commonly see it in that chronic inflammation type setting, especially with autoimmune conditions. Notice how our patient is noted to have an autoimmune disorder, right? We would not give someone corticosteroids really for a gluteal contusion, because a gluteal contusion is something that will resolve relatively quickly and is not a major concern for this patient. Okay, typically when we think about corticosteroids, they take a little bit of time to get into your system unless you use very high doses, and it's possible to use high doses in the short term, especially via like a intra-articular injection or via something like a Medrol pack. So a super common thing that happens when somebody has a back injury, they'll go to the primary care, they'll get a Medrol pack, which is a really high dose of steroids that tapers off over the course of 1 to 2 weeks. And it really helps tamp down any inflammatory nastiness that potentially causes worse symptoms than the condition really should be causing. So ultimately, for this patient, this drug has nothing to do with why she is at the doctor following a slip and fall. It's really got to do with her patient history. Okay, and that's a concept that you'll see a lot as a biller coder. You'll see patients are on multiple different medications for multiple different problems, and especially in the context of inpatient administration of drugs, it's very important to know sort of what's new, what's old, and how to go about keeping those things straight when it comes to billing and coding procedures. All right, next, we have our second scenario with the 25-year-old male. If the patient's white blood cell differential is taken, which cell would likely be elevated and why? One of the common errors I see here is people answering white blood cells or simply saying leukocytes. We already know that white blood cells are going to be elevated, but remember, we're asking about the white blood cell differential, meaning we're asking about the type of white blood cell. Every type of white blood cell sort of specializes a little bit in what it can deal with, right? We have lymphocytes, which are very good at fighting viruses and assisting in the overall immune system function. We have eosinophils, which are very good with parasites. And really, what we care the most about for this situation is our neutrophils. Neutrophils are not only kind of the first line of defense for any sort of infection, but they're sort of specialized to handle bacteria. All right, so when we look at our patient situation here, bacteria is the primary cause for concern. There's lots of bacteria in dirt. Not all of it's bad. Not all of it's good, though. And our patient clearly has signs of infection with your essentially exhibiting all the signs, the cardinal signs of inflammation, as well as the staph culture coming back to show that. So again, this question is asking about the specific type of white blood cell. And in this case, since we know there's a gram-positive bacteria, we know the answer is going to be neutrophil. All right, so that's everything for covering week 3, the case study and Career Connect assignments.